And we're back with Carola Stepper of the Cascade Acupuncture Center. And I wanted to ask you about Aculand. What exactly is Aculand?
Aculand is a fun, sweet term for the way it feels to have an acupuncture treatment. And anybody who's had one will know what I mean by that. The endorphins are being released, and it's like a nice, deep relaxation where the body goes, ah.
Okay.
And people come out and they share with us the visions they've had. Some people had dreams, some people fell asleep. It's pretty neat.
Interesting.
I recommend it.
Yeah,
it's good for your health.
Yes, yes. So it's sort of an affectionate term for just really being in a place of relaxation and positive thinking and so forth. Well, how do you get people to get comfortable with needles? I mean, most people don't generally like them.
Correct. I show them a needle on the first visit. If anybody's had blood drawn, I can put 5 of my needles in the inside hollow part of a regular blood draw needle. For the medical folks, mine are gauge 36 and 38, if that means something to people. And the sensation I describe as, you know, if I was to lightly pinch you, you would expect it to fade in 10 to 15 seconds. That's how it may be. If it's a stronger sensation, we can take the needle out. If somebody has tattoos, I will look at them and go, are you sure that I can actually bother you with this?
Right, right, yeah.
Or if a woman has given birth, you know, so that these are some approaches I use.
Yeah, so it really is relatively painless.
Most needles are, yes. I will not say there's never an uncomfortable needle, that would be a lie, but compared to other experiences people have had.
That's good, that's good.
Yes.
So is acupuncture actually considered like an alternative medicine?
It is considered complementary and alternative medicine.
Okay.
Couple different ways to look at it. It could complement Western medical treatment approaches. It can also be an alternative to them in different conditions. I also look at it in the state of Oregon and Washington. The acupuncturist cannot be a primary care provider, so we are complementary to whatever other primary care provider relationship the person has.
Okay.
In the state of California, the acupuncturist can be primary care provider.
Oh, all right. Is there any reason why in Oregon you can't? It's just
state law.
Just a state law. Okay, okay. Well, to what extent can acupuncture heal or in some cases cure?
I would answer that from the perspective of the earlier question. It supports the body's ability to heal itself. So once we have permanent degeneration, and what I mean by that, if I have a person who comes in and their hands are obviously changed by arthritis, I cannot reverse that. Neither can Western medicine. Mm-hmm. So once the body has permanent changes, meaning is permanently damaged, we can't reverse that. But other than that, things can be reversed.
What kinds of things, what kind of diseases and things would you normally treat with acupuncture?
It is a complete medical modality, and the World Health Organization recognizes over 43 conditions it can treat. It goes anywhere from all of the pain conditions that people would think of with acupuncture. The back pain, the knee pain, the ankle pain, the elbow pain, the neck pain, the headaches, things like that. We treat respiratory disorders. Colds and flus respond extremely well. Neurological disorders that people often wouldn't think about. Shingles, preventing shingles pain, it works like a charm.
Really?
Bell's palsy, that there's a drooping on the one side of the face. I would love to see people the next day. We can help them extremely well. Migraines, I have not ever treated anybody with migraines who I was not able to help. That would mean less often, less severe, less long, less medications.
Great.
Menstrual cramps, perimenopause and menopause, digestive problems, anything.
That is amazing. So what's one of the most, most amazing things that you've seen as a result of somebody being treated with acupuncture?
I would say they're all little miracles.
Yeah.
It could be the athlete that walks in with a pain level of a 9 on a scale from 0 to 10 and walks out with a level of a 2.
Really?
45 minutes later, sending me an email the next day, where can I go to acupuncture school? I want to ditch my career.
That's a good result. Yeah, that's pretty amazing.
To just seeing a person have their Bell's palsy reversed, to people getting off prescription medications, people that come in with arthritis, they get off the prescription narcotic medications, to people coming in with one health concern, and after a while we don't even talk about that one anymore because they're on to the next that they never even thought they would get to address. Yeah. It's all miracles.
That's great. Well, you mentioned medication.
Yeah.
And acupuncture is actually a physical remedy to a physical ailment. and whereas medication is kind of like a chemical treatment.
Yes.
So define the difference there.
I would consider physical medicine, physical therapy, massage, acupuncture, chiropractic, they work with the body in a way that it helps heal itself without giving the person something that they ingest. So no pills or liquids that are medications.
Okay.
And chemical remedy to me is all the pharmaceuticals, anything that you ingest, that you take in your mouth that has an effect through the digestive tract and henceforth through the vascular system.
Okay. And you had mentioned too that there are limitations. I mean, you said, once there's been permanent damage to the body, you can't reverse that. So what are some of the other limitations that acupuncture may not be able to address, whereas typical Western medicine maybe could?
I would look at it more this way. Sometimes there's conditions that are hard to treat with Western medicine. For example, tinnitus, ringing in the ear. And then sometimes people expect us to do the miracle cure because we are alternative. And tinnitus is one of those, it's plain hard to treat, no matter Western medicine or alternative medicine. The other, I would look more at the advantages versus the limitations.
Okay.
If you have a chronic diagnosis like arthritis or fibromyalgia, one of the goals should always be to prevent further progressing of the illness, because
Right.
they're known to progress. So if we can even stabilize them where they're at, manage the pain, increase the function, that's the big goal.
Yeah. Well, I want to talk to you a bit about how a patient, when they come to you, what they can expect and how you evaluate them and all of that. So we'll talk about that when we come back. Don't go anywhere, anybody. We'll be right back here on Localite.